If you ever have a red eye, here are the 6 things that you should never ever do. Hi, I'm Dr. Saya Nagori. I'm a board certified ophthalmologist, and you're watching the iFacts channel. Number 1 of 6. Never, ever, ever share eye drops. If your friend had a red eye and tells you, oh, your eye looks like exactly what I had, and then my doctor gave me this, and I have some left over, why don't you try it? This is a big fat no. There are so many different reasons that people get red eyes, and some are from infections and some are from inflammation. And if you don't know which one you have, using the wrong type of eye drop, for example, if you use a steroid eye drop that's intended to treat inflammation on an eye that has an infection, it will actually make your infection much, much worse. Because both inflammation and infection can cause painful red eyes, it's important to just go into the eye doctor and figure out what you have. Also, if your friend did have an infection, the chances that they touch their eyeball with the tip of the eye drop while putting it in is pretty high. So you don't really want to use that bottle to treat whatever is happening in your own eye. Number 2 is do your best to avoid touching your eye. If you have an eye scratch or something much worse, like an open globe, I'll explain what this is in a second. You do not want to touch your eye because this could actually make what you have worse. And I know this seems hard, especially if the eye is painful, but it could actually make the injury that you have worse because only takes a little bit of pressure to make a wound that is small much bigger. An open globe is a type of trauma where the actual eyeball has been penetrated and it needs surgical repair. This means you would have to go to the operating room to actually get it fixed properly. And I have seen patients get open globe trauma from big accidents like getting into a huge car accident, but I've also seen them get it from really light trauma. I had a patient that actually had a pine needle that went straight into the eye, and he wasn't in a lot of pain, but he was just doing some yard work and noticed that he started to have eye redness and pain and blurry vision, and that's what brought him in. But he actually had a pine needle going through the eye, and we had to take him to the operating room. Number 3, don't ignore the red eye and just use Get the Red Out drops. Get the Red Out drops can make your eyes look white, but they are not actually solving the problem. Why are your eyes actually red? This is something that needs to be addressed. A red eye could be from dry eye, it could be from a bleed, it could be from a scratch, inflammation, something more serious. So it's always important to just get it checked out and don't use drops without knowing what you have. Number 4, do not wear contact lenses. If you're not sure of the cause of your red eye and you're a contact lens wearer, take a break from your contact lenses and use glasses instead. It's always a good idea to maybe save your old contact lenses because if the red eye is from an infection and the infection does not resolve with normal antibiotic eye drops, there are rare cases where we have actually taken the contact lens, the old contact lens that the patient has, and actually ran a culture through it to see what specific bacteria are in there so we can actually get stronger antibiotics to help with the infection. This is pretty uncommon, but certainly if your eye is red, a contact lens is the last thing that you want to put in there. Number 5, do not wear any makeup or anything on the eye or around the eye that could introduce more infection, more bacteria, any kind of debris. Whatever is going on, you don't want to aggravate it more by using more product. And finally, number 6, if the eye is red and painful, even slightly painful, do not delay medical care. A painful red eye is usually the sign of something more serious. Now, there is something called a subconjunctival hemorrhage where the eye actually looks really, really red, but it is typically not painful at all, and the patient usually just wakes up with it after having maybe a coughing fit because the blood vessel has burst in the eye. Subconjunctival hemorrhages usually resolve on their own unless you're taking a blood thinner, in which case it could take a longer time. But typically that is something that you can wait a day or two to see the eye doctor. But if anything is getting worse, you certainly want to get checked out as soon as possible. Remember that this video is for education only, so be sure to ask your personal doctor about why your eye might be red. If you found this helpful, remember to hit like and subscribe below, and I'll see you in the next video. Thanks for watching.